Hey guys, it's Dr. Truesdale. Today we're going to talk about 5 features on your face that show that you are aging and some options that we might be able to do to correct those things. The entire face changes as we age. The bones, the soft tissue, the skin, and it all comprehensively works together. That makes us identify this person looks young, this person looks middle-aged, and this person looks old. So let's dive in. So when I look at any face, the first thing that I'm looking at is how is the face overall cohesively working together? Is this a pretty face, an old face, a young face? And the things that I'm looking at specifically are small little details like the hairline. As we age, right, both men and women develop baldness or alopecia. Now, female baldness is different than male baldness. Female baldness has different patterns, okay? So when we talk about female baldness, what we're talking about is like a Ludwig pattern. Now, there are different types of alopecia. Alopecia areata, there's traction alopecia, there's all of these different subsets of alopecia. But typically, when you look at a woman and she's aging, the overall density of the entire hairline is just less. So the hair is getting thinner, maybe the follicles are getting a little bit thinner. She's getting a little bit of recession centrally, but in a man, what you're looking at typically when a male ages is you're looking at temporal recession. Typically, that recession along the temples becomes central, and then usually it spreads back towards the vertex. And when we age, right, what we're seeing is that the face, the forehead is elongating, right? We're seeing more head and less hair. The hair is the frame of the face, and so that makes a person look older. So what can we do about this? We can either do a hair transplant, we can do a hairline lowering, or we can treat with topical therapies and injections. So let's talk about the surgical options. A hairline lowering is amazing because it works instantly. I can take a hairline and move it down almost a full inch, sometimes an inch and a half, with just making an incision and bringing the scalp down. What that does is it makes a woman look more youthful. It makes them look prettier, believe it or not, because it balances out the upper, middle, and the lower thirds of the face. The other option that is also surgical but takes a little bit longer of a process is a hair transplant. Now, a hair transplant, we take hairs from the back of the head and we move them individually, the follicles, into the areas where we want them to be. This option is typically a little bit better for a man because if we do a hairline lowering in a man, there's going to be an incision, and I like to hide that incision in the hairs. Now, if a man continues to bald, then what will happen is they'll lose the hairs, and then the hairs behind or in front of that scar that's camouflaging the scar will go away and the scar will be more visible. Not the best option. So typically we don't really do hairline lowering surgery for men unless we're at the same time thinking about doing a brow lift, or we're weighing the risks and benefits, or if we're doing facial affirmation surgeries. So the non-invasive things that you can do to rejuvenate your hair, right? Starting at the basic level, we can do fertilizer treatments. The way that I think of that is basically sprinkling in things that might help the hair to grow. Things like medication, minoxidil, finasteride, things like injections with things like exosomes or PRP. These things stimulate your body to basically preserve the follicle and to grow. You can take it a step further and do things like red light therapy, microneedling, right? All of these things stimulate the body to produce more hairs or save the hairs that are there and allow those little baby hairs, right, to actually regrow and to get a little bit thicker, denser, more full, luscious. So those are your different options. Let's talk about the brow. As everyone ages, the brow falls. And when the brow falls, it creates extra skin above the crease of the eye. Ding, ding, ding. What is the treatment option? Brow lift. Check out this video here where I go into a deep dive about brow lift, what you need to know, the different types. Basically, it's like a primer. If you were going to plastic surgery school, this is the video you would watch to get your cheat sheet. The brow lift is something that's powerful. It can make you look younger, less angry, less tired, just overall happier, and it can relieve some of the extra skin above the crease of the eye. Let's talk about the face. As the face ages, the bone of the face, the skull bone, changes. And in reality, what's happening is you're losing bone. So if you've ever looked at an old woman or an old man, why do they look shorter? It's because they've actually lost bone, and their skeleton, right, their spine actually compresses. So one of those things that happen as we age, right, osteoporosis, right, if you're going through menopause, you actually get shorter. You can get inches shorter. The same kind of process happens in your facial skeleton. It gets bigger, right? So The bone around the orbit gets a little bit longer and elongated. The bone around what we call the piriform aperture around the nose gets longer. It's part of the reason why the nose looks like it continues to get bigger as we age, right? We lose bone along our jawbones, right? So you've seen those old people and their faces are kind of scrunched in here and smaller. All of that is basically not allowing the facial tissues to have the support that they used to have. So it is one of the fundamental reasons why I perform fat transfer. Fat transfer is amazing because the volume of the face can be restored. Now, I'm not putting bone back in the face, but if I 3D basically inject fat into the face in artistic ways, we can basically camouflage those areas of volume loss. So we can add volume back to the cheek or the temple or the pre-gel sulcus or the chin or around the nose or the folds. All these areas can be addressed, and basically what we're trying to do is make the face look less skeletal. What is the end effect of aging? I'll pause. I'll take time. Well, it's a skeleton, right? A skeleton is what happens when the body ages long enough, right? We all turn into bones. If we don't want to look skeletal, we add fat, and that makes a person look youthful. If you think of a baby, nice, plump, fat face, chunky, right? Not that I'm trying to make you look chunky, right? Don't twist the words. But we want some fat, we want some volume in the face. So, facial aging with volume. So far we've talked about the hairline, we've talked about the brows, and we've talked about the overall structure and volume loss in the face. Now, what's my favorite thing to do? My favorite thing to do is to lift the face. The lifting of the face deals with the laxity that happens as gravity works on our tissues and basically things fall down. So there's different parts of the face that we can lift. Typically, I'm lifting the face and the neck together because as the face descends, you get jowls, you get deep folds, you get cheeks that have fallen and wrinkles and jawline doesn't look as good. So a deep plane face and neck lift is my go-to for addressing that. And literally all of those things can be wiped away with the more advanced techniques that we bring to the table. So you could take a person that looks like this and make them look like this. And you can't do that in any other way than to lift the face. Let's talk about the last thing. The last thing is near and dear to my heart because we all have it, and it's skin changes, right? As we age, the skin loses collagen and elastin. Think of these as the structure as well as the thing that gives the skin bounce. We want the skin to be supple, moist, as well as not have excess damage in terms of age spots, wrinkles, pore size. We can do steps to address these things as we age. The number one, sunblock. Number two, good skincare. Number three, chemical peels and lasers. If we do all of these things, our skin can be fresh, glowing, even after a long day of surgery. I'm super excited because we've got a big announcement coming soon. Be on the lookout for basically the best skincare on the market. I'm dropping my own, so be on the lookout for that. It's coming in the fall. Today, we reviewed all of the different things that you can look at of a face as it ages. Now, there are other things, and I can talk about this topic literally for an hour. My social media expert asked me if I wanted to look at ChatGPT to make this video, and I said, I don't need that. I got this. So if you guys are interested in a consultation, you want to learn more about the way that I approach anti-aging and making people feel good in their skin, call the office. I can't wait to see you in the next video.